There's a new concern emerging from this pandemic. Emergency room doctors in many parts of Canada say they're seeing more cases of child abuse. They believe it's a result of the lockdowns and restrictions. And as Morgan Campbell explains, there are fears if these cases go underreported and help isn't found for these families, there could be another health crisis.
The novel coronavirus has forced many Canadians indoors during the winter months, and some doctors say that may be one of the causes behind a worrying trend.
Reports of child abuse have decreased significantly during the pandemic, and we don't think that's because there are less concerns.
Since September, Dr. Michelle Ward has seen and treated more than twice as many infants for maltreatment concerns, children under the age of 1 needing medical attention for fractures and head trauma.
Particularly injuries to the brain, to the eyes that can happen when force is used with a child, even in those moments, can have lifelong consequences.
In Vancouver, Dr. Nita Jain co-authored a study looking into child abuse, neglect, and its connection to the COVID-19 pandemic. In the early months, the BC Children's Hospital, where she works, believed many abuse and neglect cases were going underreported. But during the second wave, a new problem, a rise in the number of nutritional neglect and starvation.
These are, I believe, families that were just so stretched and so stressed that we didn't recognize as a society how much they were struggling.
The Isaac Walton Killam Hospital in Halifax treats youth across the Maritimes who need specialized care, which gives doctors a snapshot of what may be happening in that region, which means children are better monitored.
Those systems are in place, and so you're right, that very well may be one of the factors that's explaining the differences that we're seeing between regions.
Doctors and advocates are also highlighting the pandemic as an especially tough time for new parents who are isolated from family and friends.
Beyond the family, beyond the community, we need our policymakers to make investments in the care of our children.
Those who work in child welfare and advocacy say they want parents to come forward if they are struggling and to erase the stigma of asking for help. Morgan Campbell, Global News, Toronto.